So it's 9 o'clock. I'd like to call the Neighbors of Dunn County Standing Committee to order here on Thursday, August 28th. And call the roll. We have a quorum. We have two that are not here at this time. Gordy Wolf and Sheila Story. Next up is approval of the minutes. I found a couple changes. Anybody else? Are you taking notes today? Oh, Chris. Okay, on the call to order, I think last time I was here and I
He may
called
actually
to
notice the error now, so.
Okay. Well, I've only been on the committee now. This is the 9th or 10th year, and that's the first mistake I've seen. So,
Well, thanks.
down on number six on the on them, it says a motion by Supervisor Lawfer to accept vouchers and financial reports. There were no vouchers.
Oh. Go.
And that's all I have. Anything else? Then I will take a motion to accept the minutes as changed.
Second.
Okay. That was Barb and Tim in that order. Was there any public comment, Carmen? And we have Steve Brown that he sits with us frequently. He was the medical director for many years. Steve, did you have any? Okay. Nothing at the request of the chair. Number 5. And number 6, community mentor administrator report. That would be you.
Okay, as always, we have Quality Assurance Steering Committee updates. So our normal meeting was 2 weeks ago now. I actually was not there because I was at another event in the city, but we went over our normal reports and there was not anything significant to report out afterwards. So it was business as usual for those. Right now, we do not have any outstanding audits from any surveys. That is something that gets added to those reports every month if we had a recent survey, but we are past the 3 months from our last one, so all of those are completed. So nothing significant out of the norm for quality assurance.
Looks good.
Okay. Next is the employment activity report, and Chris is online. Oh, and Supervisor Story just joined as well virtually.
Hi, all.
Morning.
Hi, Sheila.
Hi.
Sorry, I have a serviceman who just arrived and I can't leave.
Okay, so can everybody hear me for the employment report portion?
Yes.
Okay, so we go down, recruitment remained about the same for July. Number of direct hire interviews was 6, agency interviews 1, positions offered 6 and accepted 6. We go down to resignation, college graduation, kind of the theme of that still, graduating college, taking nursing boards, that type of thing was pretty much the gist of the offboarding. We did have one retirement. Kim Creaser, our unit clerk, retired. Then we go down to open positions, and those were adjusted accordingly. Again, no work comp lost hours, and then no missed shifts due to COVID positives. So simple, sweet, and nice.
Yeah, it's been some time since we've had COVID problems, hasn't it?
Yeah,
Oh,
knock on wood.
Oh, I shouldn't have said anything. Okay.
We did have a COVID positive staff member about a week ago now. So one household is an outbreak. So there has been one positive recently, and then we did have a rounding physician that tested positive a few weeks before that too. So we've had a couple, but nowhere near like it used to be.
Okay. 6C then, CNA training program, update and discussion.
All right. So Normally I give a report about how that's currently going and things like that. Today I have a little bit different of a report. So there's a report as well as looking for some feedback and direction from the committee. We were notified through the Healthcare Workforce Training Institute, which is the company that does the class at the neighbors. So we don't administer the class. We have a contract with a company that comes in and does the class. They utilize our space, and our classroom has been certified through the state to hold the class, but they do basically everything else. Our only other involvement is obviously the clinicals are done in our setting, and then if we have someone who is participating through the WIS Caregiver Careers program that is already an employee with us, then we're involved for the payment and things like that of their class, which then also then gets reimbursed through Medicaid. It's part of a state program. That being said, we've had no other financial responsibility in the past. We were contacted by them requesting to update our contract to include us paying for open seats for the class. So basically saying if they did not have a full class, that we would be responsible for paying the tuition fee basically for the empty seat. They were saying that they're having a hard time paying for instructors when there isn't full classes. So just for reference, in the cost that we would have had to pay the last year for the empty seats, there's 80 seats that were open throughout the year. We had 10 classes with 8 seats in each class. We had 69 students. So we would have ended up paying a little over $6,000 last year in fees. In addition to that, there's also an administration fee that they want to charge, which would be $880 per class baseline. We have some varying opinions on this. Part of this also is they do not pay us any sort of rent for the space that they use, which for other services that we allow, like our beautician and things like that, the land lease, stuff like that, we charge rent for our space that's used by other entities. So it's kind of a discussion of cost versus benefit. They have had, as I said, 69 students go through the program over the past year. They are not all our employees. So we've had a handful of employees that have gone through the program. We've had 2 successfully complete the program and transition from homemaker to CNA. That being said, that is putting out more CNAs into the general community as well. But there isn't a ton that necessarily stay in Menominee, as if they're not working for us, they're either working for ALH, which is the only other nursing home in Menominee. So most of them are working outside of the county as well. So looking for feedback on thoughts on that. They would like to start a new contract with that in the near future. But just since that is something we report about, and this was something that was highly requested to have a CNA training program from this committee, and strongly encouraged to have that program, just looking for some thoughts and feedback now that it could potentially have a cost.
Supervisor Lyon.
Carmen, I'm assuming everybody else did, because I think I saw a CC on it. I received a letter in the mail about, it sounds like it was about this. I didn't understand what it was, and I'm sorry, but I forgot to bring it, but.
Sure. Did it look like this?
It was from the Training Institute.
Sure. So they asked me about this, and I did tell them that I was going to bring this to I referred to this as a board because that's what they would understand,
Right.
the standing committee, and that we would be discussing it. So, and they have made mention that they have watched our committee meetings in the past on YouTube. So I bet they looked up your, who was on the committee and your addresses. Just
Yeah, they didn't get my name. It's interesting because it was addressed to Barb Lyons instead of Barbara Lyon, singular. But it was corrected in the actual salutation or the CC. It had it. I don't know. It was weird.
Sure. Yeah, that would be my assumption, is that they
Mhm.
looked up the members of the
Okay.
committee.
guess my button's already on. I was, as I was listening to you, I thought that perhaps you should probably start charging some rent to recover some of the cost if they're insistent upon charging for the empty seats and then they want the $800 administration cost and stuff. That would probably be a way of offsetting that. Plus, are you able to tie any type of a fee to the CNAs that take the training there and go to some other facility? And in other words, because we don't get to retain all of them and there's no way to retain them.
Sure.
You know, they're actually capable of going somewhere else. To cost share the training of those nurses, are you able to attach a fee to the CNA that goes to another facility and recover some of that cost from that facility then?
So we are not, because they sign up through the institute. So our only way to do that would be to basically charge the institute a fee, because they don't sign up through us. So we don't even know, like, we get their information in terms of making sure we have their vaccines and health and things like that are required for us. But we don't actually ever interact necessarily directly with the students except for the clinical part. So we wouldn't even know who to charge, if that makes sense. But they're like a third party. So the students sign up directly through the institute. They do all of that. So the only way to do that would be basically charging the institute for anyone, which would have to be worked into that contract. So yeah.
Barbara?
Thank you. It it strikes me that given that scenario, it sounds like there's an expectation that we are responsible for filling those classes.
Correct.
Whereas I don't understand how or why we should be dinged if the classes aren't full. I mean, this is not our responsibility, that's theirs.
I agree.
What was the cost you figured of the spots we would have had to pay for?
For last year, it would have been $6,050 for the empty seats, and then it would have been $880 per class for administration.
And there's
fee.
10 classes.
10 classes.
That's $8,800.
Yep. So 14.
$14,000. Could you do better with $14,000 giving a sign-on bonus?
Hmm.
If that's possible, even.
Yeah, there's obviously more steps that would have to be taken to do something like that through HR and I believe Committee on Administration, since it has to do with pay. But in theory, yes.
So what's your opinion?
I don't necessarily agree with paying for the institute with the amount of students that have stayed at the neighbors, would be my opinion. Especially since they are using the space rent free. If they were paying a rent to the space, I would understand a little bit more. But if they were to rent a commercial location to host the same class somewhere, they would have to pay for the space there. But we have a mutual benefit of free space. We get more CNAs, things like that was the idea behind it. Is it benefits us to have more CNAs out there, and it benefited them to have space, but now we're paying for them to use our space. Seems a little odd to me. It does look like Supervisor Story might have a question. She has her hand raised.
Sheila?
Hi, you actually asked the question. I wanted her opinion, but I would concur. When is the contract due to be renewed, or is there, I mean, is it done annually or what?
Yes, so we're at that point. So they had sent the contract at the beginning of August over to us. So they would be looking to start this in September, would be for their next class, would be what they would be looking for us to decide.
Well, in that case, I would say that it would be a good idea to go ahead and redo the contract, add the fee into the price that is to be paid. whether it's whether you do it where you add it to the student and it's paid that way, or whether you bill them somehow, I do believe we should be billing them and we should be getting that money back. So that would be my opinion.
So Sheila, did you mean by charging rent and going through the third party there and charging extra for each student to negotiate a contract that would take that money to cover what is being requested?
I'm thinking that you've got the option of either way. You either charge the institute directly for whatever it would be, no matter how many students, and then expect payment back when you renegotiate the contract. That would be what you would do. Or depending upon the cost, you would determine whether or not you want to add a little bit more to the fee for the CNA so that it can be recovered that way.
Did, Carmen, did you consider how much you'd be willing to pay to keep it there?
No, I did not actually consider maximum amount that we'd be willing to pay. And the hard part of this is that it's depending on if the seats are full. So if the seats are all full, we're only paying $880 10 times a year. That's not that bad, but it's still a decent amount of money. In the grand scheme of our budget, it's not a huge amount of money as we have a large operating budget, but it's still money. And the big thing is we haven't had that many students that are our students. So yes, we want to have more CNAs in the world, do our part to better the community, especially as the county facility of looking at the greater benefit. But also they're leaving our county too, because we don't have, it's us and ALH are the only two nursing homes in the county. And to work at a assisted living, you don't have to be a CNA. So that's part of it too. And Supervisor Story, the one thing that I will just add, based on my communication with them and the letters and things like that, to my knowledge, they're saying that we need to pay this because they're not breaking even, basically. So they can't afford to do this without us paying this. So if we're going to charge them rent or a fee, I think that just means we're no longer doing the contract.
Okay.
That's the reality of it, in my opinion, is that there isn't a way for us to say, hey, you need to pay this. It was more of a, you're here rent free, so we won't pay you. That would be the only discussion kind of thing that I can see.
Mhm.
Otherwise, if we're charging them rent and then paying them this fee, it's just money going back and forth. And I would say the outcome would likely be that they would decide that they don't want to do it at the neighbors anymore.
And
Is there a
even if,
reason?
go
Go ahead.
ahead, Sheila.
Well, I just wondered if there's a reason that we couldn't have this training at our own location.
So they do the training at NDC. They do it in Arrowhead currently.
She means why we don't do that.
Why we don't do it, sure. Similar reasons. So finding an instructor is the most difficult part of doing any sort of CNA or clinical training. That's what they're struggling with, is paying the instructors, because it requires a decent amount to pay them, as they would make more working as a floor nurse, in all honesty. And so if they're not getting people signed up for the classes, they're not breaking even. So the reason that we chose to go with this versus having our own class is both the instructor as well as the management of the curriculum and programs and things like that, that would have to be either put on someone that already works at the neighbors, or we would have to hire a position to do that, which a few years back we did create a nurse educator position, basically as a backup to if this didn't work out. So we do have the position. It is currently not funded in our budget. But if we did do that, it would be offset by the fees that would be paid if we wanted to go down that route. But there is a position in our, there is a JDQ and a position approved through the Committee on Admin a few years back.
Well, even if we were to charge the students enough just to cover the class fee, that's almost $100 extra a student.
Yeah.
So that would seem prohibitive.
Mhm.
And I don't think we can do that for anyone that's doing the WIS caregivers. I'm not 100% sure on that, but I believe there's a structure to that program as well.
So go ahead, Barbara.
Carmen, does CVTC offer a CNA program, or are there other?
They do.
Okay.
CVTC does offer a CNA training program as well, and they do their clinicals at the neighbors. So
Mhm.
we have CVTC students, we have the institute students, and then we also have CVTC nursing students that all do their clinicals with us.
And does that often result in, or how often does it result in, getting them to stay?
It does. We always do have one of the nursing managers kind of at the end of the training for the CVT students go and talk to them about working at a nursing home and things like that. The only part, the caveat to that is that a lot of nursing majors or other health care degrees take CNA because it's a requirement. There's not a requirement to actually work as one.
Okay.
So a lot of people that are taking that course are taking it to meet their nursing degree requirement. I did the same thing.
Mhm.
It wasn't a requirement, but it was something that you were encouraged to do. Was I took the CNA course. I never worked as a CNA outside of clinicals. So
Yeah,
it's a kind of a stepping stone or a resume builder for a lot of people.
I know my daughter-in-law started as a CNA at Mayo and, went to CVTC and then went on to get her, very quickly realized she wanted to get her RN.
Yeah.
Okay.
Yeah.
Let's, so the point here is,
Yeah.
do we want to encourage her to pay a bunch of money for this? Or do we tell her it's not worth it? Or do we say, Carmen, you decide?
Mhm.
Comments?
I'm okay with either scenario.
I think the money could be used, better spent elsewhere to recruit.
I agree.
I agree.
Carmen, this is coming up in September, you said, the renewal of the contract, so you don't have much time to negotiate with them at all. Do you have you come up with any ideas as far as negotiating with them for a better deal that would actually still keep the training class uh, intact yet and yet cost share with the institution then to train them to make it more feasible for us and them as well? Are they willing to bend at all, or have they indicated that they could bend, or are they really?
I haven't gotten that far in conversation with them. I wanted to hear from you folks first about what the desire was. And because I believe that was probably before you were on the committee, that this was a really strong push from this committee that this was something we wanted to do. And it's always a great thing to me, making more CNAs. We need more CNAs. And this was something that we had been focusing on for a really long time, directed by this committee. So I wanted to get direction back from this committee before even going into that discussion with them of where the priorities were on that. So I will have that conversation with them, but I do not know yet.
Thank you.
But I think the feeling of the committee is not to spend the money.
Okay.
Okay. Darn.
Thank you.
Uh, One, could the money that we're not spending be put toward some kind of a signing bonus for CNAs?
Well,
Or,
that's almost another subject off of the
Okay,
agenda. It's probably not in the budget
Currently, no.
right now. So, but
All right. So next is resident referral reports. That is in your packet. So at the beginning of the month, we had 111 residents at the facility. We had 84 referrals, 15 admissions, and 69 people not admit. We ended the month at 116 residents. We had no transfers to other facilities. We had one death this month and 9 discharges. We have been averaging closer to that 115 range, which is really good. That is kind of our goal at this point, to be right around 115, upwards to 120. We have had fairly consistent staffing in Fireside, which is our household that is short-term rehab that ebbs and flows census, and we have a little bit more control of census in that house compared to our outer buildings that once they're full, those folks are staying there for longer periods of times, things like that. But we have had consistent staffing to the point where we are able to admit more people to Fireside. I believe I shared that last month that we are slowly adding and hopefully going to get to a full Fireside in the near future. That being said, that was our household that had a COVID exposure. So next month you will see a little bit of a dip, but it hopefully is 2 weeks and then we go back up. So knock on wood, it was just one positive staff and we have not had any positive residents through this or any spread through other staff. So there might be a little bit of a dip for a little bit as those people discharged and we weren't able to fill due to COVID. But pretty steady of averaging around 115. East and West have been nearly full. At close, one was full for 3 weeks, I believe, and then the other had one opening. So that's been really, really steady. So we're happy with census. Any questions about admissions?
It doesn't look like it, so we can go on to Brady. E, Environmental and Facilities Report.
Morning. Lots got done over at the neighbors this month. IT got the new phone systems installed over there. We audited the phones to make sure that they're working properly, making sure that they're making emergency announcements throughout campus. We had a couple minor issues with it, but those have been fixed and taken care of. The fire system monitoring is going to be changing. Ahern still has the contract for that, but they're just changing the monitoring company that is going to be actually doing the monitoring. So that'll be changing at the end of September here through a different company and getting things set up for that. Also updating the policies and procedures for that as well. Fire system testing was done this month. The dry system was flooded, part of the 3-year check on that, and the wet system was tested as well. Everything went great with that. The oven install is now officially complete. The breakers were installed, and everything's working fine with the ovens. The yearly room audits have begun. We're kind of going through, checking all the rooms for safety issues or concerns. The work orders have been keeping up pretty well over there. Nothing real major over there, luckily. And the lawn care last week, Rod and Seth from Government Center came over. They did an excellent job getting rid of all the weeds and spraying and weed whipping, and it looks really good over there right now. They did an excellent job on that. The biggest thing we got coming up is we're just getting things done and prepared for the East Building life safety survey coming up, and just trying to get prepared for that. And other than that, everything's going well.
By safety survey?
I'm sorry.
What was that? A by safety survey?
Life safety.
Oh, life
survey.
safety. Okay.
Yep.
Thank you. Yeah. And what's a room audit?
So the room audits we're just, we go through the rooms. We have to inspect all the beds. We have to check for like broken welds, missing pins, or make sure the motors are all working correctly and the remotes are working. We also have to check the outlets, make sure that there's no damage to the outlets. We're looking for extension cords in the rooms, making sure there's none of that. We're also checking to make sure that there's no other fire safety hazards in each of the rooms. Also checking all the fire doors. Every resident room door is a fire door, so each one has to be inspected and then documented as well. So it's a lot of work to do the room audits.
And once a year?
once a year on those, yes.
Yeah. Well, thank you.
Yep.
Any questions, Sheila or anybody else? Okay, then 6F, you're back on.
Okay. So revalidation updates. So every nursing home in the country was required to do what's called a revalidation this year. And the process for that changed. It used to be everybody was on their own cycle, and now they wanted every single nursing home to do revalidation on the same cycle because they changed the methodology of it. So that is for any federally certified facility, which means one that accepts Medicare dollars, so which is most nursing homes. There are some that do not, but for all of us that are federally certified, which means accepts Medicare, had to do revalidation. That was head by our finance team, as it is very finance and document heavy. So Jane, prior to her departure from the county, she completed 1.5 of them, since we have 3. And then Sophia and her team has completed the other ones since. We have submitted all of them. I believe at this point, 2 of the 3 have been formally accepted. We're still waiting to hear back on the 3rd. They can ask questions and ask for more clarification, more documentation, things like that. It's basically validating that our licensure, and they're checking in on who owns what nursing homes. It's primarily for the for-profits is why they're doing this, is to make sure that everything is documented of who owns which buildings, which corporations are linked together, things like that. So it doesn't fully apply to us as much, but we still have to do it. And they're getting everybody on a baseline. So it was a big document heavy lift for finance. Originally, it was due in the spring. They extended it to August 1st as the deadline. And since then, they've extended it to the beginning of next year, actually. But ours are all submitted. So hopefully we're done with those. We're just waiting to hear back on one to make sure that it is accepted. But in theory, most of the information is the same for all 3. So if the other 2 are accepted, that last one should be as well. Any questions on that as well at all?
No, I don't think so.
Okay.
That would move us down to number 7, consideration for action to be taken by the committee. A is approval of the NDC fiscal year 26 budget request.
All right. So in your packets, it's actually after the month financials in the order that it was stapled. So the first page will say Summary Neighbors West. So in your packets, there is a summary of each building and then also an overall summary. So it's up to you folks of how you would like me to present this, what you would like to see. We do break down each building separately, as each building has different costs, different census payer mix, things like that. And then we also look at the overall operations of the neighbors. I know on our monthly reports, this committee has preferred seeing the overall versus the individuals. But there is a separate breakdown. Each of the breakdowns has the very high level revenue expense comparison, and then also the line item detail of every GL code that we have at the neighbors. So the things that go in this are obviously our salary and fringe is our biggest expense. We also include our agency staffing, which is only the added cost of agency staffing, not the total costs, basically how much we pay extra to have them compared to an internal staff, as well as all of our operating costs, any requests from the inner departments of the neighbors for their departments of things that they need to run their departments, whether that be equipment, supplies, changes of things, certifications, education, all of that is included. And then on the revenue side, it is broken down by our projected case mix. That is based on previous year's current case mix, what we're predicting going forward. We are predicting to continue having our primary payer source be Medicaid, roughly 70%, which is historically what it has been and what we anticipate continuing. It is different in each building just based on averages of what it's been, but overall campus is roughly 70%. And then Medicare, VA, private pay, and private insurance. So all of those are in there based on our projected rates. For Medicare, it's very much averages. Our private pay rate is what we discussed a couple months ago of the 2% increase. So we've adjusted that. And then our other one that is a little bit up in the air on questions is the Medicaid rates. We do not have our current final rates yet, so we are projecting based on our past rates from this past year. Though we don't know what those will increase by yet. They did come out with interim rates last week, but we do not have finalized rates yet, which we typically get sometime in the fall. Normally it's October, November, which get backdated to July 1. And then we will be able to update this to be more accurate based on what our rates are.
Supervisor Lyon.
Carmen, is it likely that they will at least stay the same, and possibly increase?
Yes,
You're not looking, it's not looking like there's going to be a decrease given
not at
the
the
current
point.
climate.
No,
Okay.
not at this point. So Medicaid rates are done through, so an agreement with the state, with CMS, the federal agency that mandates nursing homes. There is, methodology is what they call it, that determines rates, and they set a payment standard. So it's based on the median cost and 25%. So they are likely to go up. By how much, I can't say. That being said, I would not anticipate a large increase, because they should go up because of shortages in Medicaid. We've been doing very well with Medicaid. So I wouldn't anticipate a large increase, but I also don't anticipate a decrease. So budgeting at what we're currently at is probably fiscally responsible. Is there any specific questions or things that anyone wants me to go over in detail? I'm happy to do so. The big question is always, what's the bottom line? So we do have a separate bottom line for each building. So what you'll notice on the summary pages is that it all evens out.
Is this the,
Get to the right page.
actually, it's way in the beginning. It's right after Neighbors West.
Yes. So that is the summary page with all of the buildings, so the campus summary.
Right after Neighbors West, you found it. So Neighbors West was the first one, so that's 9 pages, and then there, you're looking at it, I think. Yeah, okay.
Sure.
So
Yes.
this has all of them on it, right?
Correct.
Okay.
So, and the thing that you'll notice here is that on this spreadsheet, the revenues and expenses equal out exactly. So that is because we have to have them be equaled out to balance the budget. That being said, when you actually go through the line items, there's a line item that is to other funds. So that is the surplus that each building has that would then go into the general fund. So that makes it even. So the distribution to other funds is what we were making in the black, if you would say. So each building has a different number, and then I can share the total number as well. And this is how they currently are with the old Medicaid rates and all things like that. So this isn't necessarily a final number. There'll still be more adjustments to it. But so for the West building, that number is $736,414. For the East Building, it is $1,341,628. And for the Central Building, it is $960,808. So for a total of a surplus of $3,038,850 projected. So that being said, the department heads at the Neighbors did a very good job of not increasing their ask for operating costs and things like that. And this is also based on what we currently know for Medicaid rates as other rates. And then the other thing that is always the up in the air is we project for inflation and try to budget for inflation. Our big one that goes up and down is food. That's a very hard one to project for. And like I said, these numbers aren't necessarily final, but it's as best as we can get at this point before we know rates.
Questions?
Is there any specifics that anyone wants me to explain or go over? We have a lot of line items, so I know I'd be happy to answer any questions about any of them.
And remind us what the yellow means? The highlighted yellow? In
I
all-
don't think it means anything of significance.
Isn't that, if it's not highlighted, you really don't have much you can do about it, do you?
Yeah, yeah, if it's, you're correct. That's what it is. So if it's not highlighted, those are things like health insurance, anything to do that would be on the PEP spreadsheet would be not highlighted in yellow. So that is things that, for example, our wage structure and things like that is part of PEP, as well as like WRS contributions, health insurance, those things are not changeable. And then all the other things are things that were based on projections for this year and then factoring in inflation as well.
With the projected approximate 3 million surplus,
Mhm.
does that include depreciation?
Let me double check to make sure.
Just curious.
I do not believe it
Okay,
does.
yeah, that sounds right. And that's a little more than we'd planned, isn't it?
Yes.
Okay. So I think you laid things out really, really well. Whoever you and the finance department did a nice job. Easy to understand, numbers are there.
Any questions at all?
Sheila?
No, the only thing I'm thinking about is this is for 2026, but I'm thinking ahead to 2027. And there's nothing we can do as far as carry over or anything to maybe assist our residents in the event that we have to, have not be able to get the money that we need to get from them.
Did you catch
So
that?
That's what I'm
Um,
thinking of.
Supervisor Story, you're talking about with Medicaid rate changes of carrying forward surplus from 26 to 27. Is that what I was gathering?
Yeah, if there's anything we can do to plan for that at all, or if it's just something we can't plan for. And we
Sure.
just have to wait and see how things go.
I think that's probably a bigger discussion in terms of how the county utilizes funds and especially enterprise funds, which actually Dan and I have talked about a couple times recently. So I think that's probably past the neighbors committee of roles of how the county in general utilizes funds, like the Health and Human Services Fund, the Neighbors Fund, and if the money goes back to the general fund versus the Neighbors Fund. So I think that's a larger discussion that will be had, Supervisor Story. You're just ahead of the game.
Okay, thank you. Great
Barbara,
surplus. That's great news, though.
Any questions? It looks good. It's an action item, though.
Mhm.
So we need to approve the NDC fiscal year 26 budget request.
So moved.
Thank you, Barbara.
Second it.
Thank you, Mr. Lawfer. It's on the table. Any further questions on it? Any discussion on it? All right, then all in favor of approving the fiscal year budget request for NDC, say aye.
Aye.
Okay.
Any opposed? None. It goes. Thank you, everybody. Next up, review of the financial reports.
Yeah.
Yeah, okay, no vouchers, just
We-
financial reports.
We tried with the vouchers, but I killed a tree in the process. I apologize. Next month, we'll have the last quarter's vouchers. So in your packet, as always, is the financial reports, as usually reported. So we have the overall, report as well as each facility's breakdown, and then the extra reports of the, agency cost as well as, the senior meals program. So for the overall financials, it has a projected out through the end of the year of 2025. Right now, we are projecting out about $1 million net, and then without depreciation, a little under $2 million. We did a deeper dive this month, working with Beata and Sophia to make sure that we are capturing things in there accurately. We caught up on a few things that were payments to other departments. We were a little behind in being billed for facilities department. So that's something that is an intergovernmental transfer. They bill us for the facility service since they're not direct NDC staff. We were behind a couple months in getting those billed. So we caught up on that, as well as they were working on the depreciation part of it as well. There's a couple of different things on the bottom that are projection methodologies as well. So wages are projected based on 26 pay periods and health benefits based on the year. And then we also project based on year to date less the first month. So that's our current status of where we're at for 2025.
Any questions? It's a nice number.
Move on to the more detailed reports in the back. So we have our agency staffing report. This month was a little bit higher, but if we do an average of the past 4 months, it's roughly the same. So it's based on billing cycles and things like that. When we get the bills from the agencies, when we pay the bills, it goes up and down pretty consistently, averaging around that 300,000 mark. It's still expensive, but we're still trying to maintain that as low as possible. We did just have to hire another agency nurse, so that number might be a little bit higher next month, just because that nursing rate is higher, but we did lose a night shift nurse, so that's a hard position to fill. So we're currently having an agency until we can fill internally. We also have the breakdown of the overall staffing cost, which is on there. So as agency's a little more expensive for July, it did raise the overall cost a little bit as well, but still doing all right overall with the budget for that.
Any questions? Nope.
Okay, and then the last thing is senior meals. You will notice in May, there was a little bit of a catch up done. So that will even out now. So how the senior meals for staff is allocated is it's a portion of one of the neighbor's dietary staff. So we don't have a specific position allocated to it. We used to do that and it didn't necessarily work timing wise. And if someone was off, we had to allocate money to do the senior meals program. So it's a portion of one of the employees. The employee had previously been on left, and then when a new person got hired, it wasn't allocated from somebody's position. We were just playing some catch up on the cost of the employee. It'll even out now. That was just to make sure that we were allocating correctly the cost to that department. Any questions on senior meals?
Doesn't look like it.
Right. And then the last one is the depreciation report. So it hasn't hit for July yet, so that $8,000 isn't accurate, but it will go in by the time you see it next month. Any questions on any of the financials?
It doesn't appear that we have any questions on them. So what we need to do is, I'd like a motion to accept the financial reports.
So move.
I would make that
Supervisor Lau-
motion.
Supervisor Laufer, and I'll take a second from Supervisor Story. Any other questions, comments? All in favor of that motion? Aye.
Aye.
Aye. Any opposed? None. It passes. And that's it, I think, except for next meeting time.
It'd be the 25th of September.
Okay.
Any other announcements of any kind? Carmen? Brady? Anybody?
9 AM, correct?
Okay, nothing then. We are adjourned. Thank you for coming after a long night.
Bye, everybody.